All right, next we'll talk about our nebulizer treatments, and I'm just going to demo how to set up a nebulizer. I'm only going to be nebulizing saline in this because I don't want to utilize any medications. So your nebulizer comes in a kit where you have all your pieces, and you do have to put this together prior to giving it to your patient. There's also a mask connector that you can use with this, but it's packaged separately. So the first thing I do is I tear open the top of the bag. You want to make sure that you're not dropping everything as it comes out. This is the reservoir. It does come apart, but this is where your medication's going to be going. I usually leave it attached, and I just put my medication down the top when I'm ready for that. Your tubing, this is your oxygen tubing that's going to connect to your tank. So one end is going to go on the nebulizer piece where your medication goes in, and the other is going to connect to your oxygen regulator. You have three more pieces. Your T piece is going to go on top. And then you have the mouthpiece that fits in the larger side. And then you have your extender piece that we want to extend out. It's going to go on the smaller side. This takes the patient's exhale and it brings it away from their face, because as you see, it'll create a mist, and we don't want that blowing directly back in their face. You also don't want it blowing on you, so you can actually kind of turn this away from you so you're not getting that patient's exhale into your face. So when we're ready for our medication, I just take this T piece off top and I squirt my medication down. You just want to make sure you're squirting it down the side, not essentially down that blue piece in the middle. Put your connector back on top, and we're gonna set our flow meter from 6 to 8 liters for this. So I base it on what my patient's symptoms are. If they're pretty mild, I'll go ahead and just put it on 6 because it will last longer. If they're having a lot of difficulty breathing and maybe need that medication a little faster, I'll up it to 8 liters per minute. This does bend, so you can bend it away from the patient or yourself. And then you just give the patient this to hold, and they'll breathe in the mouthpiece here. If they're not able to hold this, if they're too unstable, this does come off, and there is a face mask piece that you can put on there for those patients, and it goes on their face just like a non-rebreather.